notice that most people don't really go to the hospital? About 80% of people don't really go to the hospital, except it is very, very serious. In today's episode, we will be looking into why they don't really go to the hospitals. This is Inside Healthcare Podcast, where we unpack healthcare beyond the surface. My name is Sims, and I have,
I'm praised.
and this is Inside Healthcare Podcast, where
Every voice matters.
All right. What so in this moment we introduce our guest to you, Justina. You are welcome. She's a registered nurse in the healthcare profession. So please go ahead.
All right, so just as you have said, my name is Okeji Justina, and I'm a registered nurse. Presently working in a private organization.
So let's just go straight to the point. So let's start from where we even let's start with the question itself. Why do people why is it that people only go to the hospital when it is serious? They don't go. For example, now you can, because of people don't really go to the hospital for headaches. It's very rare. Headaches, stomach pain, this. No, they don't. So for let me use pregnancy as an example now. Everybody knows that, oh, when you are pregnant it is serious, they'll go to the hospital, right? So why is it that it is only during times when it is serious they feel like, okay, I must go to the hospital? That is when they go to the hospital.
Okay. Actually, I would say this under four subtopics, which is fear, cost, past experience, and beliefs. So I would give those points under it. So firstly, I'll talk about fear. So I feel like fear is actually a very big reason why most people don't want to come to the hospital. We have people who say that, oh, they are scared of being admitted, or people who say they are scared of injections. They don't want that pain. I've seen a grown man cry over injection, so so that's a big fear. So yeah, so but those things people say, oh, that I don't want to be injected. I don't know how serious. Like they don't know how serious the condition that they are having is. They don't know how serious it has become. So they just people can tell you that, oh, what I don't know is I is better. Let me just not know it. The moment I know it becomes worse. So some people want to hide under the I don't know it. I'm not worried most times. So I feel that fear is actually one of the big aspects of it, that people don't want to step foot into the hospital because they are scared of being of of the outcome of that sickness. So fear, that's one which I've talked about. Now let me go into cost, which is hospital charges. So people will tell you actually that hospital can be very expensive. Of
Mm-hmm.
course, it is expensive and it has to be expensive because when it comes to our health, it's health is it's I don't want to use the word complicated, but it's a lot. It encompasses a lot of things, and you I actually don't have an idea of what diagnostic services charge for tests for investigations, but I could say that it's a lot. Imagine having to do an MRI scan or having to do a computed tomography scan, that's CT scan for the brain. I know that. And the thing now is that most people don't even keep the money to for being admitted or to take care of them. So they don't keep it somewhere. They don't Most people don't even save towards it. So that's a thing for people that actually are not there financially. So they feel like it's a lot, and they don't have it planned yet. And also for people that are not under, like they're not using HMO, what we call HMO, or all those things can actually be quite expensive for them, of course. And so I feel that place of cost can be a reason why people don't want to come to the hospital, and they feel that they didn't keep the money for they didn't keep this money at home. And there's a lot of things that has to do with that. We've seen patients that come to the hospital and they are struggling to pay for just consultation fee. That's as little as that could be. So we know that there are a lot of people that are struggling. People are trying to actually get, even to feed. It's a bit difficult. So now talking about sickness, You better look for another option. I don't want to. I don't think sickness. So things like that. So I feel that could be also a big reason, especially in this part of the world where people, where the government are not really sponsoring a lot of health things. So it could be a bit difficult. So that's for cost. Then when we go to past experiences, yeah, you know, actually, I've heard something. I don't know how true it is, but I've heard something that somebody said, the reason why he cannot come to the hospital is because hospital use people for research.
Research.
Yeah, like they become hospital lab rats. I said, I don't know about it. I'm inside the four walls of the hospital, and I'm not sure that we've done that before.
I'm just hearing that
Yeah,
for the first time.
I'm telling you, like that they will just be using different kind of. I said I don't know where you went to. I don't know the hospital you must have gone to, but really, I feel like some people can have a wrong perception. It could be a wrong perception, maybe from what they heard. It's not even what they didn't have, some people did not even experience it.
Yes.
It's just the edge. I like, let me go. I'm not going. I don't want to go. So things like that could be from past experiences with, it could be with healthcare workers. Healthcare, working in healthcare it can be a lot. I'm telling you. It can be a lot. I have different funny stories, but it can be a lot, especially having to, like, maybe you are doing night shift and you've done plenty night shift and you now, maybe by the third night
Just tired already.
you're already tired. So one somebody should not just come to me now and I told you something and you're asking me again, what did you say? I can get angry, but there are some things that actually, because you've learned so much, and as a registered nurse, you've been trained to, because you have to be empathetic, so you have to put yourself in the patient's shoe that, oh, they are going through a lot. So you just have to be like, okay, you just have to take a deep breath, then repeat it again. But still, some people still ask again. But really, it can actually be stressful working in an healthcare facility. And so some people might not, all those things that we're talking about. Okay, I can work on my communication skills. I can learn how to talk to a patient calmly because I know what they are going through. It's not everybody that knows it. Some people will still give it back to you like, please don't stress me and all of that. So some people will tell you that that's the reason they are not coming back to the hospital. So yeah, so it could be as a result of that, and it could be as a result of a loss of a closed one. People tell you that, oh, because this person died in the hospital, then what if I also go there and I also die? So that's about past experience. And I talk about belief. Yeah, when it comes to belief could actually be divided into cultural and religion. Let me say cultural in the sense that in our house, when we fall sick, this is what we use, and that is what you will use. So you're not going to the hospital because that is what you use. So that could be there. And when it comes to religion could, I feel like some people actually feel, I don't want to generalize it. Some people actually feel that sickness can be spiritual. Yes, as much as I'm a believer, I'm a Christian, and as much as we can say that, yes, we pray to be healed, but I still feel that there's a place of common sense in healing, in the sense that as much as you are praying, you are also finding help with people that actually went to school to go and specialize. They went to go and stress them. There was a lot. So we know how it could be that we actually went to go and read on these things and all of that. Yes, I've seen patients that they didn't just depend on medical care. They all were also praying, and I saw the outcome. The outcome was very good. It was so good. So as much as you're praying, find else. So I'll still talk more about that, but I feel that that's also one thing that people's like, I'm not going to come to the hospital because I believe that I'll get healed. It's a good thing. Yeah. So we've had reasons of that. Like, we just trust that everything will be fine, and also that, okay, this is how it has been with this past person, comparing self, and this is how it has been. Your younger brother was sick the last time. We gave him this. We gave him we've had these home remedies that we do and feel like, oh, it worked. So it worked for your brother, it should work for you. And body differs. So things like, I feel those are the main things that actually could be reasons that people don't want to step into the hospital wards. Yeah.
So how do we get them to go? You mentioned someone having high blood pressure. So, and we know that this is dangerous to the health. So
Mm,
how do you like try to get the person to go? At least they say prevention is better than cure.
I tell you.
So how do you make them know that you have to go for the sake of your health?
Okay, you won't always meet all those people. Maybe you meet one person, two-person. But I will feel that one thing we can actually do to help people is that encourage them to go for routine checkups. Like, you don't have to wait to be sick. Hospitals are not meant for sick people.
Okay.
Hospital is meant for everybody. You don't have to fall sick to come to the hospital. You might not be feeling anything. You might not feel any symptoms. Just come to the hospital. So you need to let people know that, see, hospital is not based just on it's not only based on treatment. We also do promotional health. We do preventive health. So it's about wanting to prevent sickness. It's about promoting your health. We want you to be better. If you are good, we also want you to be better. So you encourage such people. Yeah, like I said, that I have a friend that he is his blood. He knows that his blood pressure was high because it was a family thing, and as much as that, he still feels that, oh, he doesn't want to come to the hospital because he doesn't want to be stick to medication. He has to be using this medication for the rest of his life. I get it. But as much as possible, I had to sit him down and let him see that, okay, would you rather, okay, for example, let me say that you know that there are some illness that what you need to take care of that illness is just 1,000 naira
Mm-hmm.
if you do the right thing earlier. And if you now wait maybe for like 10 years, you don't want to do it, you can spend up to 1 million for that same sickness.
Yes.
So that's where I started to tell him that, "Look, you know what? I did it to the point that I took a book, I took a pen, drew his art, and just to, it wasn't a way of instilling fear, but let him understand what is actually going on in his body. And see, at this point, you feel that, okay, it's just your art. It's going to spread to other part of your body. So I had to let him understand all these things, the complication that comes from not coming to the hospital early. So that was what I actually used, and he was able to come. But he also took a place of having to keep calling him. Have you used your medication today? No. Okay, I use it. So things like that could actually help people, helping them to see, educate them to see that, okay, if you don't actually take, like, be quick about those things, it can actually worsen over time. And there are some sickness that come as silent. They call them silent killers. You will not. I've seen a lot of people that they did not actually whatever what they were going through got to us because they did not know. That's another different thing entirely. Some people can still be feeling that, oh, I'm feeling something in my body, but this person, and it's true, it's not that they were lying, they did not feel anything. I have one funny story of a guy that came with his friends to the hospital, and they were young guys, I think about 20 something, at the range of, they are in their late 20s. So one of them now said he wants to check his BP, and they, okay, fine, just do that. We checked, and he was like, okay, he also wants to check. Like, okay, that's good. We later admitted the guy, because his
The
BP was
person,
over 200.
the person
I'm
that
telling you, he
accompanied.
accompanied the person to the hospital. He said he never felt anything. So there are some sickness that you don't know, that they're already doing a lot of damage, and it's just, we call them silent killers. A lot of cervical cancers, it's just silent. Diabetes is silent. It just keeps doing its damage, and no sign, no evidence of any sign. So that's where it comes, like, just, you don't have to fall sick. Just do routine checkup. Do you want to do it monthly? Do you want to do it every 3 months? Do you want to do it every 6 months? Just nobody, we don't bite in the hospital. We don't actually bite. Just come and do a routine checkup just to be sure that you are fine. It could be checking blood sugar level, doing blood pressure. I think there are many pharmacies that do blood pressure check now. So all these things are actually being easy. We have them around us, but I hope that we'll get better at it.
Okay, so still talking about the written tests. We how often should you do it?
Oh well, I feel like it depends on. I think it depends on the risk of that disease. You know, there are some diseases that we actually feel that they they can be passed from a generation to another generation.
Okay.
So knowing that okay, this thing happened to my mom, my parents, my grandmother, my grandfather, you want to pay attention to it. Probably you from history heard that oh, grandma died of stroke. You want to actually start checking your blood pressure early because all those things. It's possible that grandma did not check her blood pressure, and it actually led to that complication. So I feel that it depends on having to look at the history. Okay, there is history of cancer in this family, and you that person wants to quickly take a quick check and all of that. So when it comes to routine checkup, so I feel like it differs per people. One can come for routine checkup in the hospital and everything is fine. Well, we can ask you to come in 6 months. We can ask you to come in a year. But for someone that okay discovered something, we can ask you okay, please come in every 3 months so that we can keep checking. So I feel it differs with risk of those disease.
Okay, so still on that routine test actually. We have there are some tests we call complex and there are some that we just be like, oh okay, they are normal tests to do. You can just walk into the hospital in 3 months just to so can you give us the how would I say it? Probably the list of for example now more like RBS which is the random blood
Blood sugar.
sugar. Um some people do aside being a diabetic patient, I mean aside from diabetic patients, how often should we do that? Then there some other tests. Okay, for example, you can walk into the hospital, you can do um you can do HB1AC, um you can just do your PCV, which is the lab
Okay.
work.
Yeah.
So just give us list of tests that okay in 3 months or 6 months you can just go into the hospital, do just to be aware that okay
Okay.
I'm
Everything
still
is
there,
fine.
everything is fine.
Okay. I feel that when it comes to what kind of routine check to do, it has to do with at least you want to check the basic parts of the body, the basic part of the that can tell you what is actually happening to the organs. I feel like urinalysis is a very very underestimated test that actually can tell a lot of things. In urinalysis, you can tell if there's a presence of infection. In urinalysis, you can tell if there's this person has blood sugar issue. So as little as urinalysis can be, it can point to a lot of things. So for one, feel that urinalysis is a very good test, even if you cannot afford a lot of it. Urinalysis, let's say every 3 months, it can actually help you to put yourself in check of all those things actually. And well, there are other tests. I'll say ECG, where we check the heart. ECG is also a good one. It also helps us to know what's the condition of the heart and all of that. So yeah, there are many tests that are not that still cost effective. Like it's not too expensive that one can actually go for. Yeah, that will not break the pocket. Let me say.
All right. So we know that we cannot actually force people. Like
Mm.
there's this adage that says you can force the horse to the water. You cannot force the horse
To
to
Yeah,
drink
drink
to
the
the
drink that
water.
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 Yes.
Yeah.
So since we can't force people to like okay go to the hospital and they need to even know that like okay let me say they don't even they don't really have the full knowledge of okay the benefit of them visiting the hospital like if not in months or something like constantly.
Regularly.
Okay, and aside the fact that some people, like from what you told us now, that some people has post what's it called post traumatic
Stress
syndrome from
Mm,
experience,
from
and so
experiences.
because of that, they don't want to visit the hospital, and it is important for their health, and I think that's why we are here for their betterment. So, what can people like that do? Like, I mean, health is more like our life. You are not fine, you are not fine.
Yeah, no.
There's nothing you can do about it. So what can we do? Like how can we encourage the audience? Like what can we tell them? What can they do?
Okay, so in the sense that, like, truly, um, there's something we say in health that early detection, like you detect something early, it saves life. It also gives you this chance. It gives you a good quality kind of life,
Mm-hmm.
because no matter what you want to do, no matter where you want to go, good health, oh my god, it's the best. It puts you in the position to be effective at work, puts you in the position to be effective at many things you want to do. So we actually advise actually that in situations like that, like we said, come just do routine checkups actually, and don't have the mindset that hospitals are is actually is just to treat illness. You don't have to fall sick to come to the hospital. You come to the hospital, we do health education. We educate you on how you can take care of yourself. We tell you on dietary requirements. We talk to you about what to do and what not to do. I work in a pregnant women clinic, and the way we emphasize on dietary require
So
it's so I'm telling you, we and because there's a lot of information out there that is polluting the mind of many people a lot. Like people will tell you, don't do this, don't do that, don't, and it's really affecting a lot of people. So in situations like that, we tell you that see, as much as possible, seek professional help. Don't just the same way that you want to sew a cloth, you will not take that cloth to a carpenter.
of
So
course.
don't try to listen to people who don't have experience or probably who don't even have a knowledge on those things. So the best place to have knowledge about health is the hospital. I can't want to save my money and take it to, not take it to the bank. Because I know that the bank is the best place where my money can be saved, yeah. Or maybe I want to invest. I know that's the best place where I can do all those things. But when it comes to health, I also feel that people have a lot of options. And the moment it comes to the point that there are options in your mind, it makes you feel that actually humans, the moment humans have options, they don't really want to put their self into that thing. So I would actually advise people, as much as we have options, we've had about options. Do you know, to the point that because we know that in Nigeria, people tend more to about treatment. I have to start for health, like primary health care. We have to come together. We have to start working with traditional healers so that we can have access to the people of the community. So you have to, so that we can let them know what is actually going on. The hospital is not a scary place. It's a place where you can actually. So you have to start working, because the trust that people have in traditional healers, I'm telling you, it's very high. So in that situation, we actually advise that see, don't just come to the hospital with the mindset that it's only when I'm sick. Come to the hospital with the mindset that the hospital has everything, every information for me that has to do with my health. And for me to be able to do everything I need to do, I need my health to be at the I tell you. So I think that's one advice I would give. Just come to the hospital, do a routine checkup. There are many things that are actually free. You can't come to me to advise you now on, and I'm charging you one every money like that. For no, for people that I know they cannot afford it, I would not want to do a free thing. But really, I feel that there are people should not have that mindset that it's only when I start feeling something in my body. We should let it be a norm that, oh, I have to go to the hospital for different things. There are a lot of other things that happen there.
So you're saying people should make it part of their life.
Exactly. A lifestyle.
So sorry, do you know that this issue of healthcare? I'm so concerned about the healthcare professional stuff, healthcare reaction, nurses, doctors, healthcare professional reaction, basically. Do you know that if 60% of these people stop reacting negatively to
To
patients,
patient.
it will bring a lot of patients back to the hospital.
Actually,
So
true.
I feel like they can do better in that, because state hospital, yeah, they are meant to be affordable. So for the less privileged, people that can afford. So imagine someone who is a a middle class person
Mm.
going to a private hospital, when he or she knows that, oh, you know what, this is the only place I can get solution to my problem here, I need to go to the hospital, right? But because I've had one or two encounters with the people there, and I feel like you mentioned, you said some people prefer to go to a private hospital because of
Mm.
the, so imagine that kind of person now saying, "Ah, you know what, I don't want to go to that kind of hospital because I know how they behave, yeah, I know how they feel, how they make you feel, and with no reason I need to go to the hospital. So at the end of the day, let me go to a private hospital." You understand? Which
Mm.
will lead to, at most times it leads to, what's it called, death.
Mm.
Because I feel like, okay, yes, I want to go to the hospital. I have the knowledge now. You know, there is a difference between I don't have the knowledge of, I don't want to even know whether I should go to the hospital or not. But and yeah, I know I have to go to the hospital, but I don't want to go to this particular
Hospital.
hospital. So I feel like if these people can work on themselves
Mm.
and put themselves in patients' shoes, yeah, there are some situations where you'll be like, your own is
Restricted.
getting too much. But at least if we can't eradicate it, let us reduce it. Let us reduce it. That is it. Then I feel like
That can actually
that can
help.
actually help. So
Actually, true. Yeah, true. Actually, I feel that our educational institution can actually do more of that, helping to train um, healthcare workers, healthcare, let's say students in schools to actually do better. Actually, I feel that we have a generation of nurses. I think it's something I've noticed. We're having a generation of nurses that actually know what they are doing.
mhm,
They actually can actually say that okay, they know how to actually relate with the patient. Yeah, though we can still do better. We can actually still do better. And you know, people's excuse used to be that, oh, because I'm doing a lot. Of course, yeah, I do a lot, but you also have to know that that's why you're there. And you know, people always want to be somewhere where they can trust those they are going there to meet. People want to be able to trust you. So the moment you are discarding their words or making them feel less of themselves, they already feel less of themselves already. The moment they are coming to the hospital, it shows that they need help. So it already puts you as a healthcare worker in a position of an helper.
mhm.
So the moment you're now trying to, so they came with one ego that is already injured. So you now bruising their ego more with your words, it's already complicated. So I feel as much as possible, what we do, it's a privilege.
Mhm.
A lot of people could do the same thing, and we should see it as, oh, being able to help people, being in the position to help people to get better, it's a privilege. It's a privilege that requires strength, that requires. There are times that I'm leaving my house, I'm praying to God that God, the people that I want to meet, I want to be able to help them because you meet a lot of people every day.
Mhm.
You might not meet them again. You know how many people you see on the road, they will start shouting, you know, like, you know, people. It's give, you know, there's this joy that comes with having to take care of a patient, and that patient goes home in good health, and the patient looks at her like, thank you. It's a privilege. So I feel people should see that compassion, what the outcome of what comes out of what they are doing. People should have an understanding that the role that they are playing, it's a very, very important role in the life of people. And I also feel that maybe I shouldn't go there, but I actually want to talk about how that most people that I feel that they do that, they're actually giving this vibe of they are not professionals. So it's giving me this, if you actually went to school and you were taught,
Mhm.
you shouldn't be acting like this
Mhm.
because they must have taught you about things. People go through a lot. Being sick is a lot. I've been admitted before. I know what it means to be on that sick bed.
Mhm.
So I can actually put myself, though maybe not to some certain level, but at least to a basic level, I can put myself in their shoes. That being that period of sickness is a lot of time. So professionals, healthcare professionals can actually do better.
Okay, now speaking for the audiences, what basic step, what's the simplest step that you advise that a family or a household take in building a cordial relationship with their local clinic, not just for when there are emergencies? What's the first step you advise that they take in building that relationship with their local clinic?
I don't understand your
Like,
question.
what step, what's the first stage that you advise a family or a
Okay.
household to
Relating
take.
to being ill.
Yes, relating to not seeing the hospital as just an emergency precaution,
Okay,
but for
exactly.
a regular
Routine.
regular
Okay.
routine. So what's the first step you advise those at home, those listening to take?
Okay, actually, well, I would say that when it comes to hospital, actually, I feel that care actually also starts from the home. There are many things that we actually do to our health that we don't actually have to go to the hospital for. There are times that we can start having heartburn, and you want to take something as easy as ice cream. Do I want to advise everybody to? But so I feel that care starts from the home, and the moment we start seeing that the hospital is an extension of a care that actually started from the home. Yeah, and as much as possible, well, I would still say that people should. It's just I feel it's mostly a mindset, and looking at this part of our world, this part of the world that we are in, people have they've tagged hospital based on what I said, like past experience and all of that. But I would still advise that as much as possible, you are thinking that, oh, okay, as a family, what should I see? Just have a mindset that the hospital are not there to bite. They are not there. They're actually there for you. The hospital was built for you. You should see it as you are a part of it. It's a part of you. It should become it's a part of a community. Hospital did not build themselves to be outside of it. Like we are just there, we are separate. Because I actually feel like people feel like that. That hospital they feel like it's something that should be built outside of the community. But it's actually a part of the community. It's part of everything. It's part of us. It exists just the same way that we need things for. I need banks for my money. I need different things. We should also know that hospital is a part of our life. It's nothing we can't escape from it. We just have to see that and come to that consciousness that it's a regular thing.
All right. I just wanted to ask, you know, for example, myself, I've not been admitted to the hospital before.
Oh, really?
Yes.
That's a good one.
Now, what can we do as touching people like that? Fine, either you are sick or not. Hospital is meant for us, like mental education,
Exactly.
sickness, pregnancy, and all like that. So, what about people that okay, any health issues they have, they go to the pharmacy, they get medication, and they use it and they're fine.
And they're fine.
Like yes, like is there any balance to like okay, still encourage them to go to the hospital, or once they are fine, at least they've gotten the drugs in the pharmacy and they're fine.
Okay, I mentioned the other time that hospital is not just based on treatment. We don't the focus of the hospital is not focused on treatment alone. We also focus on prevention of illness. We also focus on promotion of health. So, as much as I'm feeling something is wrong with my body, and I go to a pharmacy, it's good. It's actually good, but it doesn't end there. It doesn't actually end there. And that I'm fine does not mean that, like WHO, when I was in school, when they give us the definition of health by WHO will tell you that no one person is 100% healthy. I don't know how they want to do it because the definition of health would it cuts across all parts of the body. So it cuts across spiritual, cuts across emotional, cuts across
Mental,
social, mental. So you can't tell me that all that area
Yeah,
they are
fine.
they are
is fine.
okay.
Exactly. So there's always a part of us that,
Okay.
of course, you see how some people will leave their house very good looking and all of that, and they get to the road and they are shouting at all that. Is that WHO tell you that you are mentally not and not mentally not healthy? But really, as much as all of those things, so I feel that the moment we take off that mindset, that I feel that's actually the mindset that most people have, that hospital is meant for treating illness. Having that mindset that no, that's not the only thing we do. We educate people, we teach you, we help you, we monitor your health. You don't have to feel anything to come to the hospital. Just come. And okay, yeah, you can have access to clinics, you can have access to pharmacies around. And also, I would actually advise that, see, as much as when it comes to your health, don't joke with your health. Don't joke with your health. Your health is very important. Very, very, very important. Don't joke with your health, because we have a lot of minor, I don't even know what to call it. People that they are not professionals, that are doing some treatment, and you know that these people are not professional. In the way they talk, you already know they are not professional. They probably went to learn how they can inject people. People learn these things too.
Yeah,
Yes.
sure.
Of course, I had one of recent that a guy learned how to do surgery, and he was doing surgery.
Mm-hmm.
Although that you YouTube videos,
Exactly. So
to do something.
people are doing a lot of. There are
A lot of wonders.
some people can be very confident in rubbish.
Mm.
Mm. Some people can be some things that even those that are professional cannot do. That they are still
Exactly.
like, they're still like, okay, let
In
me
the
still learn
process.
more. Some people can be so confident and they'll tell you I can do it. And they want to use you as
Experiments.
experiments and all of that. So I would actually advise, don't joke with your health. As much as possible, that the money is not really there. The little one that you have, use it to take care of yourself. The truth is that most of us, we focus on other things and we ignore our health. So we don't want to we don't like, even as much I'm okay, I'm fine, there's nothing wrong with me. Please, there's a lot of things that can be silent and they're already doing a lot of harm to us. So I would actually advise that, say, come to the hospital, do little checkups. We talked about some little cheap tests that you can do that can actually help you and all of that. See, if you have to save for it, please do. And stop visiting chemists. I don't know if those places still exist.
Of
Like
Uh-huh.
course,
chemists,
Yes.
they still do.
They do.
visit chemists. I know that some people actually employ nurses and medical professionals in
To
their
run it,
pharmacy.
yes.
Now,
Yes.
I don't know. I don't know if you still do it, but I know that they do that sometimes. So please, as much as possible, seek professionals. Go to places where you know that this person actually went to school to learn this thing. Don't go to places that you know they are going to tamper with your body and use your body as experiment and all of
Research.
that. So as much as possible, take care of your health. As spend good money on your health.
I have a question, more like a concern, and that is on herbs.
Okay.
Because yeah, I work in the hospital, and being a pediatric nurse, you see a lot of things. So there's this particular case I would talk about. They brought the child in, I think maybe 4 years or 5 years, unconscious, and maybe GCS of 3 or 4/10.
Okay.
And where they brought him as an emergency, or the mother, people were everywhere, and yeah, we stabilized the patient on oxygen and all. And when we asked the mother, no, I heard the parents arguing. Why will you give? I mean, they said this in Yoruba. Why will you give this person this herb? Oshima Funya boy, Oshima Shekinka. I told you to bring my child to the hospital. If this child dies, and you understand kind of thing. So is this and the according to the whole issue? I mean, for that particular patient, the herbs that was given actually worsened the whole. It was
Worse
it
situation.
was yeah, it was malaria, yeah, but it's affected the whole brain. It's really worsened the whole thing. So what can you say about herbs?
Mm, okay. So actually, when we're being taught pharmacology in school, we saw that there are actually some medications that are made from herbs, that are made from trees. Bark of the tree, you know, too. It's yeah. So we know that there are some medications that are actually made from all those things. So, but these things are actually taken to the lab
Mm-hmm.
and tested.
Mm-hmm.
Tested in animals.
Mm-hmm.
There are many some medication they will let you know how it was tested.
Mm-hmm.
Tested in animal, tested in a certain amount of people. And when they did all these things, they checked the side effects.
Mm-hmm.
Okay, so we did a test of this medication. We saw that okay, this person is vomiting. This other person has headache. So medications have side effects like that. And actually, how many would you need?
Mm-hmm.
to treat this kind of illness.
Yes.
So when it now comes to herb is not taken to the lab, is not tested,
Mm-hmm.
and the truth is that toxicity is very very common with medication.
Mm-hmm.
A little of it might. So I'm not actually here saying that don't use herb, but the herb you're using, can you tell me that you are using the right
Proportion,
amount
yeah.
for what is actually?
Mm.
And there are medications will always have an effect. It will always have an effect. There will always be a side effect to this medication. Yes, we might actually not talk about it so much, but it will, because the normal medications that we use, they have side effects. They have a lot of side effects. That's so these apps, as much as we are saying that okay, we want to use it and all of that, can you say that you are using the right amount for what is actually wrong? Can you say that? Because do you know that there are some medications you don't combine?
Mm-hmm.
Now I'm using this app. I'm using this app. And the truth is that if it was actually tested, we're not supposed to be used together.
Together.
So the moment you use them together, there is now this reaction that is
Reaction.
happening. Another thing, there are actually some apps that what they use to make those apps is serious. I've there was one app that I saw that they said they were giving to a newborn baby.
Okay.
I'm always big on because of the maybe because of I'm now being exposed to pregnant women care, because when they come for antenatal clinic, we always emphasize it. Please don't give babies see their stomach is very small. You don't want to add herbs to no, please don't do it. 'Cause I've seen a lot of innocent babies dying for these situations and all of that. So yeah, so as much as we're now telling you that okay, apps, there are some things that they put in these apps, like this they put there are some apps that they push in app.
Mm-hmm.
Yes.
And they want it to work well because they need that hotness to enter into all the body, and and start feeling it from inside out. It's a good one, but really now, let's imagine that this patient that you gave this app to has a kidney issue
Mm-hmm.
that has not probably been diagnosed or even has been diagnosed. And you are saying you want to treat malaria and you are giving this app so that it can come and all of that. That app is going to go and do more damage to the kidney, because the kidney, what the kidney does is that it wants to bring out all those toxins, things that the body does not actually need. And most of these herbs, they contain toxins.
Mm-hmm.
Even the medication we use contains a certain amount of toxins that can be controlled. But because it's a herb and you are using it out of abundance of how available it is, you're just using it, and it's going there to damage the kidney that is already stressed. You are now over stressing out of it. So I'm not saying herbs are not good. Some people even tell you that was what our great grandfathers were using. Now the first thing I used to say is that you can't compare our great grandfather that were eating fresh food. The generation that we have now, Indomie generation, spaghetti generation, canned food generation, food that has been stored for days. These people don't eat. You can't compare their intestinal tract to yours now, because our intestinal tract, it is what. So there are a lot of things to consider. As much as you feel that, and I'm telling you that there are some people that they actually died, the so-called great grandfathers, they died out of situation like this. But do we all know those things? So we can't really tell. It might have injured a lot of things, and it might have affected their brain.
Yes.
But because we don't have full understanding of all those things, there are some practices we do to newborn babies now that we tell them that, oh, don't do it to your babies now. And they'll say that grandma said that she did it to my husband. That's why I could marry him. It's good. But like, okay, so you want to do it to your child. Now, those things, maybe that's why your husband is struggling to understand mathematics. And truly, because as much as those things, as simple as turning babies,
Exactly.
we advise that don't turn babies. But I'm sure they must have turned me.
Of
Some
course.
go as far as closing the nostrils just to put pap in the mouth.
And so there are many practices that we actually
It's crazy, like,
discourage. We discourage them, like, please don't do these things anymore, because it might just be that they were lucky.
Mhm.
You might not be so lucky. Look at what you said about that child. There are many child that must have given that same up to that survived. They might, let's say they were lucky, but that child was not lucky. So don't let them use us as
Specimens.
experience. Like, okay, at Kogmola, we learned from this person's experience. Oh, no. So the best thing that we can do, avoid things and start. I think it all comes to the place that we need to start trusting healthcare. We need to start trusting medications. We need to start trusting that these people, they're actually there for you. They want you to be fine. Everything. So every medication you're using has gone through a lot of processes. It was not just put out there. Paracetamol, as little as it is, has gone through a lot of. That's why we tell you, okay, this is the dosage you should use. Don't use more than this. Don't use more than that, because it has been tested. It has gone through different processes. So if your app can go through those processes, it's fine by me. So that's what I
Okay.
say.
Thank you. I mean, it's really
Insightful.
it's
Insightful.
insightful, relatable, interesting. And I think for me that's it. I don't know for Eniola. I don't know for
I give you my
Yeah.
I don't know for Praise. I don't know for
It's
been
been
great.
interesting, like you said.
Yeah,
It's been
okay.
great.
So I just hope next time you come. Okay, so thank you so much. Thank you. We really appreciate. So there's this special diary that we have where we get our guest autographs
Okay.
so that we can tell people that we're privileged to
To have them.
this presence. So I want you to also go through it. This is
Okay.
it. So you're a page per person.
Okay.
Then
All right. So, right.
thank you. It's beautiful.
This is a pen now.
No, that's not so on behalf of Inside Healthcare Podcast, this is for you.
Thank you.
Manage this.
I'd like to have you.
I'm glad to be here.
So much.
So this is the end of this episode, and if there is one thing to take from from this conversation, it is that healthcare works better when system listens to people. So my name is Sils,
Yeah.
Praise.
Shelua.
and this is Inside
Inside
Healthcare
Healthcare
Podcast,
Podcast,
where
where
every voice matters.